If the only time you see your GYN is when you're pregnant, you're probably not seeing your GYN enough. Now, of course, if you were pregnant in the last year, then you might be actually up to speed. But for many women, it's probably not the case. The other situation is if the only time you see your GYN is when you are due for a pap smear, you also might not be seeing your GYN enough. I know, shocking, right? And by the way, when I say GYN, I'm talking about obstetrics and gynecologist or whomever performs your well woman care. It could be your family doctor, it could be your internist, it could be a nurse practitioner, it could be whomever does this, okay? So this is sort of the phrase for the person who performs your well woman care. So yes, when you're pregnant, you do need to be seeing the OBGYN, of course, and of course when you need pap smears. But other than that, there are actually times you should be seeing the GYN that you may not be doing so. And why, you ask? Well, first of all, there's a lot of preventative things we need to be doing. I'm not a GYN, I'm a PCP, a family doctor, but GYNs, they need to be doing pelvic exams, breast exams, talking to you about your preventative care. So how often do you need to see them? Well, you need to see them at least once a year. That's right. Might be even more than you thought about because, again, especially with PAP guidelines changing, whether you need to get a PAP every 3 years, every 5 years, or what have you, it's different than what it used to be back in the day. It used to be that getting a PAP smear was synonymous with seeing the GYN. Now you may not need a PAP smear every year, but that doesn't mean you don't need the GYN every year. And in fact, you do. I want you to make sure that you are seeing them every year. And as I mentioned before, it's because there's a lot of things that they need to be talking with you about. The other thing I would say too is it's kind of like me as a primary care physician, right? So I say I want to see my patients every year for a well person visit, right? Where we go through prevention stuff, mammograms, colonoscopies, all that kind of stuff. And I want that to be different than what we call a problem visit. The other thing is if you have GYN issues, right? You've got problems with your periods, you got fibroids, you are trying to conceive, menopause, hot flashes, whatever you want to be talking about, you should make a separate visit for that. We call that a problem visit. The idea is make sure that regardless of whether you are due for a PAP or not, and regardless of whether you are pregnant or not, so long as you weren't just recently pregnant and are up to date with your GYN care, you need to be seeing your GYN at least once a year for a physical, for a preventative, a well woman exam. And then, of course, your problem visits in between should something arise. I have to admit, when I was in med school and residency, I wasn't as up on my yearly exams as I should have been. I got my PAPs, but even sometimes they were a little bit late during that time. Since I've been out of med school and residency, I've been much better about getting them going every year and then getting my PAPs when they're due. But the idea is we have to stay on top of this, ladies. Guys, let me know what you do. Make sure you share this video with anyone you think it might be helpful for. I'm Dr. Jen, practicing family physician, on-air health expert and video creator. On Facebook, if you've not liked and followed my page, please do. For those of you who send stars, I respond personally. Thank you so much. On YouTube, please subscribe to my channel. Click the little bell for updates. Check out my website, drjencaudle.com. Guys, I'm Dr. Jen. I'll see you soon.